there is a need for pediatricians. Absolutely. I'm not going to say that we don't need pediatricians, but we do not need the number of pediatricians that we have, especially because most of them are not critical thinkers. And when you kind of look at the numbers, I go back to what I can pull off the internet. And if you look at the number of kids or the pediatric population, so from like 1990 to 2020, the pediatric population went from like 64 million to 73 million, which is a growth of about 14%. So that's the pediatric population, children from 0 to 17. That's a 14% growth. That's pretty good. So wouldn't you think maybe the number of pediatricians would grow by 14%? Well, they haven't. The number of pediatricians, it's astonishing. They have gone from about 25,000 in 1990 to over 60,000 in 2025, which is 140% change. And that's not even including all of the little pediatric specialists and everybody that is a health professional that, specializes in pediatrics. And that number is close to 160,000. So you look at the growth of the pediatric population, you look at the growth of the number of healthcare people that are in pediatrics, and you would think, wow, we're going to have this huge decline in chronic disease. And we all know that chronic disease back in around 1990, it was at about 12%. And today, depending on what you're calling chronic disease, we're looking at 30%. And that's not even including obesity. So we have a real problem here, people. We started with this population of children. We have this huge, it's a huge number in pediatrics. And then we have this huge growth in chronic disease. And what's the problem?